Gentlemen, let's talk candidly about something that changes for almost every man after 50. It's the quiet concern most men don't speak about, but many think about in private. Potency, stamina, urinary comfort, and that natural confidence in your body's response. You may have noticed things are not quite as immediate as they once were. Maybe firmness isn't as consistent, recovery takes longer, or there's a new sense of stiffness in the lower back and hips. Many men assume this is simply the unavoidable cost of aging and quietly accept it as permanent. But what if that assumption is incomplete? What if part of what you're experiencing is not just age, but a buildup of physical tension, reduced circulation, and mechanical pressure patterns in the pelvic region that develop slowly over time? What I want to share with you is a simple daily self-care approach that may help support blood flow, ease muscular tension, and improve nerve responsiveness in the pelvic area. It is not a magic solution, and it is not a replacement for medical care, but many men report noticeable improvements in comfort and function when they become consistent with practices that target this region. The idea is straightforward. When circulation improves, when deep pelvic muscles begin to relax, and when nerve compression is reduced, the entire system can function more efficiently. Everything in this area is connected more than most men realize. I'm Dr. Sofia, and for over a decade, my focus in urology has been understanding not just the medical treatment of male health concerns, but the underlying lifestyle and mechanical factors that influence long-term function. Many of my patients tell me the same thing in different ways. I don't feel like myself anymore. And more often than not, they are not broken. They are dealing with systems under chronic stress, tight muscles, restricted blood flow, long hours of sitting, and accumulated tension that quietly builds over the years. The human body is not designed for prolonged stagnation. It is designed for movement, circulation, and release. When we break down the common factors behind reduced performance and pelvic discomfort, three main mechanisms often show up together. First is circulation. The arteries supplying the pelvic region depend on healthy, flexible vessel walls and consistent blood flow. Long periods of sitting, poor posture, stress, and inflammation can reduce this efficiency. Over time, blood flow becomes less responsive, which can affect sensitivity and function. Second is muscular tension. The pelvic floor muscles can become chronically tight due to stress, posture, and unconscious clenching. This creates a constant state of internal pressure that restricts optimal function. Third is nerve irritation. The nerves in this region, including the pudendal nerve, can become compressed by tight surrounding muscles, which may reduce sensation or delay response signals. When these three factors combine, the result is not sudden failure, but gradual decline in efficiency. The important thing to understand is that these systems are not fixed. They respond to relaxation, improved circulation, and consistent care. This is where a simple daily technique may help support the body's natural recovery processes. The focus is on a small area between the lower abdomen and the base of the pelvis, often referred to in traditional systems as an energy convergence point, and anatomically known as the perineal region. This area sits at the center of several important muscles, nerves, and blood vessels involved in pelvic function. The practice itself is simple and takes about 60 seconds. With the body in a relaxed position, ideally lying down with knees slightly bent, a small amount of natural oil can be applied to the area to reduce friction and allow smoother movement. Using gentle, controlled pressure, not forceful or painful, small circular motions can be performed. The goal is not intensity, but consistency and relaxation. Slow clockwise movement for a short period, followed by counterclockwise motion, helps encourage local circulation. A light press and release pattern can also be used to gently stimulate deeper tissue layers. The entire approach is based on calm, steady contact rather than aggressive pressure. One of the most common mistakes men make is applying too much force. This area is sensitive and responds better to gentle stimulation. Excess pressure can create irritation rather than relief. Another mistake is inconsistency. Doing it occasionally will not produce meaningful change. The body responds to repetition and routine. Even 1 minute daily, when done consistently, is more effective than longer, irregular sessions. Position also matters. If the body is strained or tense during the practice, the pelvic muscles will not fully relax, reducing the potential benefit. Comfort and ease are essential. Some men also use this type of practice only in moments of concern or performance pressure, but this creates the opposite effect. The nervous system responds best when it is not under stress. When practiced calmly at a neutral time of day, such as before sleep or after a shower, the body is more likely to enter a relaxed state, which supports circulation and recovery. Natural oils such as castor oil or black seed oil are often used because they provide smooth glide and may offer additional soothing properties for the skin and tissues. The purpose of the oil is not just lubrication, but also comfort and relaxation, helping the nervous system associate the practice with ease rather than effort. When combined with simple lifestyle habits such as regular hydration, light stretching for the hips, and reducing long uninterrupted sitting, many men find that pelvic tension gradually decreases. As tension reduces, circulation improves, and when circulation improves, function often becomes more responsive. Some men also notice secondary benefits such as reduced lower back stiffness, improved bladder control, and better sleep quality due to reduced nighttime discomfort. It is important to be realistic. These changes do not happen overnight. Most men who stay consistent report subtle improvements within the first couple of weeks, with more noticeable changes developing over several weeks of daily practice. The key is not intensity, but patience and repetition. What makes this approach valuable is not that it replaces medical treatment, but that it gives men an active role in their own physical maintenance. Instead of feeling passive about changes in the body, it encourages awareness, circulation, and relaxation in a region that is often neglected until problems appear. At the end of the day, your body is not declining in isolation. It is responding to long-term patterns, and patterns can be adjusted. With simple, consistent care, many men find that comfort, confidence, and physical responsiveness can improve in meaningful ways even later in life.